Good evening, everyone. Thank you so much for joining us for the webinar for the Transgender Leadership Initiative Round 2 proposals. I have to admit this is my very first time using our brand new webinar system by myself at home. So can a few of you type in the Q&A box if you can hear me? Just type yes or you can hear me, just so I know a couple folks are actually hearing what I'm saying. All right. Yay, I see some yeses. Thank you. Appreciate that, everyone. So my name is Shannon Weiss, and I'm the Program Manager for the Transgender Leadership Initiative at AIDS United. My pronouns are they, them, and theirs. My goal is to help you through the application process in whatever ways I can, and I'm really excited about this initiative. I hope that you are too. We also really appreciate your interest in transgender leadership development and for taking the time to participate in this virtual meeting, especially since for some of us this is a little later at night than some of us might be used to working. So this meeting is going to give you an overview of the application process and help you participate in our Transgender Leadership Initiative. We have to give our thanks to Janssen Therapeutics, which is currently our sole funder for this important work. We really appreciate their generosity in being able to offer this initiative. So as you likely heard, this webinar is being recorded. We will be sending out a link to the webinar to everyone probably tomorrow, so you can refer to it just in case you need to. That will be on its way to you. And we're also keeping the webinar in listen-only mode to cut down on background noise. So you can submit questions at any time using that Q&A box in your webinar window, and I know some of you have already used it quite successfully to let me know that I can actually be heard, so I appreciate that. So during this meeting, we're going to do a brief overview of AIDS United as a whole and then the Transgender Leadership Initiative in particular. Then we'll be covering the requirements of the grant, after which we'll highlight the key areas of importance and application logistics. We're also going to be covering the required attachments and the review process, as well as the steps that need to be taken to apply through our 3 application options, which are FoundationConnect, our online system, recorded Skype call, or video. And then we'll review the application timeline and a little bit about the grant year. And then finally, we'll have time for Q&A. As we're going through things, feel free to jot your questions down and hold on to them, or you can type them into the Q&A box as they occur to you. Either way is fine. If we run out of time at the end of the webinar to answer all the questions, I'll type up responses to them and email them out to everyone. So don't fear if you ask a question and we run out of time. I will get you a response to that question. It just might not be this evening. So AIDS United's mission is to end the AIDS epidemic in the United States, and we do this through strategic grant making, capacity building, and policy advocacy work. The Transgender Leadership Initiative is one of many grant-making and capacity-building initiatives we have at AIDS United. We also have an amazing, skilled team of policy experts that help inform and advocate for policy at the national and state levels that help people living with HIV that are most impacted by it, including trans communities. If you have not already checked out our website and you want to hear more about what AIDS United does, you can look on our website, which is aidsunited.org. The Transgender Leadership Initiative, more specifically, is a response to how deeply trans communities are impacted by HIV and the unique challenges that trans folks face in accessing HIV care. We know at AIDS United that more efforts need to be undertaken to recognize the realities of transgender lives and to enable transgender individuals to take up leadership roles to address the community's needs. So TLI, because saying TLI is much easier than saying the Transgender Leadership Initiative. There's a lot of syllables in that name. So TLI supports the ability of transgender leaders to improve HIV service delivery. It increases trans leadership presence in policy arenas and creates a cohort of connected transgender leaders. We launched TLI in May of last year and made 8 grants in the first round of grant making. You can find descriptions of those projects on the Transgender Leadership Initiative section of AIDS United's website. If anyone is curious to read about those and you can't find that page, just send me an email and I'll email the URL to you. So this new RFP opens up applications for our second round of grants. We're really excited, as I mentioned, that Janssen Therapeutics is supporting this important initiative again. So getting down to some nitty-gritty stuff, eligibility. So we only allow 1 application per organization to be submitted for consideration, Applicants must be a nonprofit 501c3 tax-exempt organization as defined by the IRS. We will verify tax-exempt status before awarding grants. And organizations that don't hold a 501c3 status may apply through a fiscal sponsor that has a C3. Organizations should be viable with or without the grant, and these funds are not intended to help start new organizations or to serve as replacements for discontinued funding. There is a full list of items that grants can't be used for in the RFP document that you received in May. Applicants must work with transgender individuals who are either living with HIV or at risk for HIV. Those organizations that are current or past recipients of funding through AIDS United are eligible to apply for funds through this RFP, and of course, organizations that have not received AIDS United grants are also eligible to apply. Grant organizations may apply for up to $20,000, and we anticipate the average grant amount will be $15,000 and will award a maximum of 5 grants. And that's just simple math. $100,000 that we have available in grant making divided by $20,000 is a minimum of 5 grants. I think I might have said maximum. A minimum of 5 grants. The actual grant amount, as always, may be different from what applicants requested, depending upon the decisions by the review committee. The overall grant amount we intend to grant on, as I mentioned, is $100,000. So applicants must be able to utilize the grant funds within a 6 to 8 month period that begins September 1st, 2018. So if you're thinking about applying for something that happens outside of the grant period, you'll need to retool what you're thinking of applying for, because your activities must be finished by April 30th of 2019. And then one final report will be due 30 days after the end of each grantee's project period. And when that is will depend upon whether you have a 6, 7, or 8 month project, but they must be submitted by no later than May 31st, 2019. And we will have grantees give an informal interim report at our convening. Speaking of which, the convening is a cohort-wide grantee convening that will take place in January. One individual from each funded organization will be required to attend, and that person will likely be a transgender leader who is being trained through each funded project. But AIDS United will cover the costs, and we'll work with you to figure out who that is, and then we'll cover the costs associated with attendance at that meeting, including airfare, lodging, and food. So you won't need to worry about expenses for that. And let's see, I see a question. All right, I'll answer this question. I probably should leave other questions to later, but I see a question here. Is an organization eligible to apply if we currently have a grant that we received through a different funding opportunity at AIDS United? Yes, you can. We welcome all organizations with all kinds of relationships with AIDS United. So yes, please go ahead and apply. So for this RFP, we're intentional with respect to the overarching areas of focus. Applicants must exhibit an explicit commitment to addressing HIV as a racial and social justice issue, and applicants must practice meaningful involvement of trans people living with HIV/AIDS, which we'll talk more about in a minute. It's also important to AIDS United, but not required for this initiative, for grantees to apply an intersectional approach when developing and implementing their strategies. So if you're not familiar with intersectionality, it's a framework for understanding how interrelated systems of oppression support discrimination among people who share overlapping social identities. So, for instance, a person living with HIV may face racism, transphobia, and HIV stigma all at the same time. So all of those things must be addressed if we're to see an end to the HIV in the U.S. and globally as well. You aren't required to include intersectionality in your application, but we do encourage applicants to start thinking intersectionally in their work if they're not already doing that. Leadership development. This is the most critical component of TLI. Your project must be focused on leadership development, not the delivery of direct services to your clients. So you've already passed the first test, which was the letter of inquiry, but we want to make absolutely sure that you focus your proposed project on leadership development and don't pivot to focus on direct service when you submit your proposal. And if you hear a lot of italics and underlining in my voice and bold in my voice, that's because this is so important that I really just cannot emphasize this enough. So leadership development can be demonstrated in a number of ways that are laid out in the RFP, but those are listed on page 4 of the RFP. I'm not going to go through all of them, but they include things like a person of trans experience, gaining greater responsibility within your organization, getting professional mentoring, joining a board, starting or increasing advocacy activities, things along those lines. Direct service, on the other hand, while it is critical for fighting HIV in trans communities, it is not the focus of this initiative. So things like passing out condoms during street outreach and doing HIV prevention workshops or support groups are direct services, but they are not automatically leadership development. Those things can be components of your project, but if you include those activities, your application really has to demonstrate how those things will increase the leadership skills of trans participants. So for this initiative, direct services cannot be an end in and of itself. So if you want to include something like street outreach in your project, your application must demonstrate how street outreach encourages or how street outreach increases the leadership skills of trans folks in your community. So please make this leadership component of your proposal as clear as possible. The review committee will take this extremely seriously, and only applications that are expressly focused on leadership and that discuss specific leadership outcomes will be considered for funding. Before writing this RFP, and again before submitting your proposal, please refer back to that page 4 of the RFP and read that section called Intentional Focus on Leadership Development to make sure that your proposed project is responsive to this initiative. It takes way too much time, as you all know much better than I do probably, to write a grant proposal that's off the mark. So please, please, please make absolutely sure that before you submit your proposal and before you write it, that it's responsive to that page 4 part of the RFP. If you have any questions about leadership development versus direct service as you're working on your proposal, please ask either during this webinar or drop me a line or give me a call afterwards. So again, italics, italics, bold, important, super, like lots of, I can't emphasize that enough. So I mentioned earlier meaningful involvement of people living with HIV/AIDS, or MIPA, because again, that's shorter to say. So MIPA stems from the concept of greater involvement of people with HIV/AIDS, or GIPA, which means meaningfully involving people living with HIV in the programmatic, policy, and funding decisions and actions that impact their lives by ensuring that they participate in important decisions. MIPA affirms that people living with HIV must be involved in decision-making at all levels, including their own health and how organizations serve them and how their communities and the nations respond. So I've pulled the definition of MIPA shown on your screen from the U.S. People Living with HIV Caucus. If you want to read the HIV Caucus white paper on MIPA, their website is hivcaucus.org. So for the Transgender Leadership Initiative, we strive to increase leadership among trans individuals and to increase the leadership capacity of organizations serving the trans community. So TLI will mirror MIPA principles with the expectation that transgender individuals must be involved in decision-making at all levels of this project. That starts with from the time you begin to write your proposal, if you have not already included trans folks when you submitted your LOI, please start immediately to involve local trans community members and or staff members and or board members, wherever folks are, to include them in your work as you're developing your project. And then if you receive a grant, as you start implementing it, you must have trans folks involved in the implementation of your project, and you must have them involved in the evaluation of your project. So like with leadership development, the review committee will look very closely at how much involvement people of trans experience have had in each of your proposed project. So here are some questions to ask yourself if you're thinking about, is your project responsive to MIPA? So ask yourself, have you consulted local trans communities in thinking about what project you might want to do? Have you involved transgender folks in designing your leadership project? Do you have trans people on your staff and board? Will you be hiring transgender folks to carry out your proposed project? And will people of trans experience be involved in assessing whether your proposed project is effective? If your answer to most of those questions is yes, then you are meaningfully involving trans communities. And if your answer to most of those is not yes, then you know where you've got some room to grow, and you can definitely work on that. So I mentioned earlier that we also strive to create a cohort of connected trans leaders. So this learning cohort is another exciting opportunity of this initiative. Grantees will network with each other and support each other through regular calls and at our convening. There's also the possibility of individual coaching between grantees. So if one grantee is really strong in one area and another grantee is interested in gaining strength and experience in that area, then we might have the possibility of hooking them up with each other so they can provide some peer-led coaching. Grantees will also elect one member to be a representative on AU's Public Policy Council. And we'll talk more about what the Public Policy Council is once we actually have a slate of grantees. But that membership will allow AIDS United to better include the needs of trans communities and HIV advocacy priorities, and it will give the representative the ability to help shape AIDS United's and other organizations' national policy agenda. So it's a really exciting opportunity for someone who can take advantage of that. Application logistics, getting even more nuts and boltsy. So please keep your responses to the equivalent of 5 single-space pages in 12-point font in Microsoft Word or your favorite word processing program that you have. Please be clear and thorough in your responses. Try to anticipate the questions that the review committee is going to have. Don't assume they know your organization and your work, because we don't have the time in this grant review period for the review committee to have questions, for us to go to you to get answers, for us to take those answers back to the review committee and reconvene the committee for them to further consider your proposal. So you got one shot. So as Hamilton said, don't give it up. You can apply through FoundationConnect, recorded Skype call or video. One of those methods will not be seen more favorably than the other, so please choose whichever one you're most comfortable with, but only choose one. So don't apply using more than one method. It takes too much time to do that, so pick one method and stick with it and apply to that. Complete application materials are due by 5 p.m. Eastern Time on July 6th, and incomplete applications will not be reviewed. So don't give us any excuse to cut your application out of the pool. Make sure you submit everything that we need you to submit. So the details on each submission method are in the TLI full proposal invitation document that I sent you along with your invitation to apply, starting on page 3. So you should have all the details you need in there for each submission method, but we will be going over some of those shortly. So attachments. Here are the attachments that you need for your proposal. We require a list of your organization's board of directors with their professional affiliations. And those professional or community affiliations are required. And community affiliations are generally where your board members work. If they don't have a formal job, you can list things like activist, longtime transgender community member, or something else that will give us an idea of where each board member is coming from. Please do include those affiliations. They are required as part of your board list. It allows the review committee to assess how many perspectives are represented on your board. There's not a right or wrong answer to the community affiliations for your board, but what we want to see is that your board is not filled completely with lawyers. Nothing against lawyers. Lawyers are great to have on a board, but we want to make sure that there are multiple perspectives on your board. If you don't have your own 501c3 status, you'll need to submit a signed letter of agreement with your fiscal sponsor. If you do have 501c3 status, you do not need to submit your 501c3 determination letter from the IRS. You can. It's not offensive to do that, but save yourself an upload. That's not required. The diversity table referenced in the RFP, on the other hand, is required of all applicants regardless of 501c3 status, and that can be downloaded from the FoundationConnect system, as well as from where the TLI RFP is listed on our website. Please be sure you have that table and not a previous version you might have. We update that table every few years. So if you've got one floating around from a while ago, please make sure that you're not using that. And if you have problems finding that table, please let me know and I can email it to you. Any memoranda of agreement or letters of support should also be uploaded to the system. These are not required, but they are strongly recommended if your application talks about you working with a partner organization in your community or with the consultants. The review committee will want to know that those partner organizations or consultants know that they're included in your proposal. So if you talk about working with a local organization, please let the review committee know that organization knows that it's being implicated in your proposal. For the review process. So the applications will be reviewed by a team of external experts, the majority of whom will be people of trans experience, and I can guarantee you that the overwhelming majority of them will be people of trans experience. Each reviewer We'll sign a conflict of interest and confidentiality agreement. So if there are any conflicts of interest with any review committee members, they will not be reading an application with which they might have a conflict. Applications get reviewed by a combination of numeric score and qualitative comments. And I do want to assure people that there is no minimum score to get a grant. The scores are merely a way of helping us organize the meeting discussion. We always end up giving grants to organizations that don't get stellar scores, and we always end up not giving grants to organizations that score very high. So don't worry about the scoring, and those scores are listed in the questions we sent. Those questions will say how many points each one of those responses is worth, just so you have a guide, and it gives you an indication of how important each response is to AIDS United and to the review committee. The reviewers will come together for a meeting where each application will be discussed in turn, and then out of that discussion, the committee will make funding recommendations, which will be approved by our president and CEO. AIDS United staff do not have a vote in this committee. It is carried out, the votes are carried out expressly and exclusively by the review committee members. So I'm going to now talk through some of the logistics for each application method. If you're going to apply online, you'll need to use FoundationConnect, which is our online system. To click on the To Begin Here application, or excuse me, in the TLI full proposal invitation document that I sent to you, along with your invitation to apply, there is a sentence that says to begin an application, click here, and the here is underlined. That's the link you need to click to start your proposal. You're then going to be taken to an eligibility quiz. This is the first of those questions to determine if you're eligible. You all should be, but there should not be any problem with that since we invited you to apply, but it is a requirement that you go through the eligibility quiz in order to access the online system. So once you pass the eligibility quiz, you're going to come to this page. If your organization has ever used FoundationConnect to apply for a grant through AIDS United or another funder, or if your organization has used the system to submit reports to AIDS United or another funder, then your organization will have an existing account in the system. If possible, use those login credentials so that you're not creating a new organization in the system. If you're not sure if you have a login, please email me. You all know my email address. It's swees@aidsunited.org, and it will be on the last slide here, so you don't need to write it down, just in case anyone doesn't already, because I haven't already emailed many of you many times. If you know your username but you can't remember your password, click that Can't Access Your Account link to reset your password. That's right next to the little green login button. Now, if your organization hasn't applied for a grant or submitted a report to AIDS United using the system, you'll need to click a Register, which is the second green button on the page, to create an account. Before doing so, however, please be sure to bookmark this page so you can easily get back to it, although there is a link to get back to that in the RFP document itself. So once you create an account, be sure to save your username and password, of course, because you will need them to log in the future. And then once you're in FoundationConnect, you can work on your proposal as many times as you like. You'll just need to save before you log out. Once your application is saved, you'll be able to edit it by logging back into the system and then clicking the pen and paper icon to the left of the grant name, which is shown by the blue arrow on the screen. And then the request type for this grant, which will be located where the orange arrow is, will say TLI 2018 full application, which is a little different from what's there. This is a screenshot from last year, and I just didn't feel like redoing it for that little teeny bit of difference. If you only have one thing in FoundationConnect, this is the only thing you'll see. But if you have previous proposals, grants, or reports in FoundationConnect, this list will potentially be longer, so that request type will help you identify where it is you need to be working on things. So a few tips for using FoundationConnect. As with many things, as with many internet-based and cloud-based systems, please use Chrome or Firefox to access the system. Frequently, users experience issues with Internet Explorer not loading FoundationConnect or not saving responses. And Internet Explorer actually doesn't play well in the sandbox with many cloud-based systems, so this is just another one of those. Now, as I mentioned, you are able to save your application so you can work on it in phases. But you have to enter text into all the required fields in order to save the application and view the Attachments tab. So if you hit Save, but there's not text in all of the required fields, the application will not save. So to get past that, just put the word text into a test into a field, put the number 1 in a field. If there's an email address field or phone number field, it will probably require they be formatted correctly. But otherwise, sticking the number 1 or 3 or whatever, you pick your favorite number into a field will satisfy the system that you have something there. Just make sure before you submit that if you've worked on this in multiple stages, that you actually check your responses to make sure that you've taken out all of your numbers or the word test out of all of your fields, so that they actually so that you actually have real data there, because the system will verify there is something there. The system will not verify that the something there is an appropriate response to the question. So do make sure to check that before you submit. Do also hit save often once there's text in all the required fields, as the system will automatically log you out if too much time passes, and it won't warn you when it's about to log you out. No online system is perfect. FoundationConnect is no exception to that, and this is one of the kinks with FoundationConnect, is that it sort of has an internal timer that is secret only to itself, and if it thinks you've been inactive too long, it will kick you out. And by inactive, it means you haven't hit save or gone to another screen. It doesn't count you typing in a text box as activity. So please be very careful of that. And because of that, as well as a couple other things, we strongly recommend completing your narrative in a Word document or your favorite word processing program of choice, and then transferring it into FoundationConnect. In addition to the whole annoying logout thing that FoundationConnect does, sometimes web browsers crash, and you'll lose everything if you haven't saved it. Word also allows you to monitor your page count. We do ask applicants to limit their responses to 5 pages at 12-point font. But you'll find in FoundationConnect you actually can enter more information than that. And the reason we've done that is that we need to allow applicants as much room as possible in each response to say what they need to say. Now, you'll find some fields, like the mission statement field, is pretty short, but most of the others many of them allow up to 8,000 characters, which is a pretty decent amount of text that you can type. We just don't have we don't want to micromanage so much that, we tell organizations you can only submit 3,000 characters for this, field, and your response to this can only be 4,500 characters and things along those lines. So we allow applicants lots of wiggle room to determine which responses need to be the longest for their proposal. So while the system will allow you to submit more than 5 pages, please don't do that. You want to be kind to your reviewers. It's very hard to read, 10, 20, 25 proposals, and then if a reviewer gets to one that's really long, that's hard for reviewers to do. So please make sure that you follow that page count. When you're pasting responses into FoundationConnect, if you're having issues with your response going over the character count for a field, go ahead and paste as plain text, because any HTML formatting like bullets or bold or italics will get converted to HTML tags in FoundationConnect, which will count against your word count in the system. So it might not look as pretty, but if you're running up against word count or character count issues, go ahead and paste as plain text. And there's an option when you're pasting into each field, to paste as plain text. Now, if you decide that you're not interested in doing FoundationConnect and you want to apply via a recorded Skype call, please email me by June 15th, which is next Friday at 5 p.m. Eastern, so we can schedule an appointment. All Skype applicants have to also fill out an online form with some basic information about your proposal before the call. So this will allow us to gather things like your address, your requested amount, your 501c3 number before we're actually talking, because there's nothing really exciting about us spending time with you telling me your address and me typing it up, and you telling me your email address and me typing it up. Plus, if I'm typing those things up, there's a chance I'll make a mistake. Whereas if you're putting them into the system, you're unlikely to make a mistake. So those forms are required. If you go to page 4 of that full TLI proposal invitation document that I sent you along with your invitation to apply, you'll find a link called This Qualtrics Form on page 4, and click that, and that will take you to the Qualtrics form, and Qualtrics is a survey software where you'll be able to fill those out. So Skype applications will last approximately an hour and with specific time limits set aside to respond to each question. So we want to make sure those calls don't go over an hour so one applicant doesn't get more time or significantly more time than others. Although if it's less than an hour, that's fine too. We don't have to take up the full hour. You should be prepared to provide the information requested by all the application questions by the time we have the call. And then after the phone or video conference, during the conference, I'll be frantically typing up your responses, and then I use the recording if I need to go back and refer to something as I'm cleaning up my notes, because I'll take notes frantically, but there'll be a mess of typos and errors and misspellings that I'll clean up afterwards. And then if I need to go clarify something, I'll go back to the recording to find what I need to clarify. And then what will happen is I will email a document to you that contains your responses. Not verbatim, they will not be verbatim responses, but they'll be hopefully everything that you said, although not verbatim. And you will have 3 working days to return that summary to me, and that will be a time during which you can add things, you can take things out, you can move things around. And we've all had the experience of hitting submit and thinking, oh shoot, I should have added XYZ. Well, those 3 days is your time to add XYZ, as well as to make sure I got everything correct from our call. So you'll then send that back to me within 3 business days, and then I will manually enter that into our FoundationConnect system, the back end of our FoundationConnect system, so you will end up with an online proposal. So please make sure to schedule the call with us to allow yourself adequate time to review responses and get them back to me within 3 business days. So you'll need to take a look at your schedule and how things look for you to have the time over a few days to look through those responses and really give them some good time so you can make any changes you need before you get them back to me. It's also important to note that reviewers will not see your Skype call recording. They're going to see the approved written responses that you give to me. So if you're considering this submission method, don't plan to read your responses verbatim off a piece of paper or a computer screen that you've already written out while we talk. If you're that prepared, just go ahead and submit online, because you'll have much better content. I promise you, there is no way my note-taking will be as good as your verbatim paragraph responses or your verbatim sentences or bullets. I will not do as well as you. So if you're so prepared that you've already written your responses out, go ahead and just submit an online proposal. It will not serve you as well to do a Skype call if you've already written everything out. Skype applicants must submit the required attachments by July 6th at 5 p.m. Eastern Time. And then our third option is a video proposal. So we'll also accept proposals this way, of course. And in this situation, applicants will film themselves responding to questions. You also have the opportunity, if you want to, show us where your space is, to show us, to have, a couple staff members help you with the responses. And actually, you could have more than one staff member on a recorded Skype call as well. But it allows you the ability to film yourself recording responses. You have to respond to all the proposal questions and do so in the order that are listed in the TLI full proposal invitation document. So unlike the Skype call, grant reviewers will receive your video to watch. So there's no written summary of video proposals for them to read. They're going to see your video that you submit to us. You want to make it as easy for the reviewers as possible to get all the information they need to find and listen to. So don't make them hunt through your video to find a particular response that might be out of order. It would also be really helpful to reviewers to tell them which question you're answering by saying, I'm now answering question 2 in the project narrative section, or now I'm going to tell you about what success would look like for our proposal, or give them some indication that you move from one question to another. We received one proposal last year where their responses were all over the place and out of order, and it was very difficult to watch and analyze that video, because when reviewers are watching your video, they'll be taking notes. Because when we're discussing your proposal, if you submit a video proposal in the review committee, reviewers won't have the chance to go back and say, well, what did they say to question 4? Because there won't be time to do that in a video, whereas there's time is written for a reviewer to go back and skim that. So they'll be taking notes on your responses, so you want to make that as easy for them as possible. Like with Skype proposals, all the video applicants must fill out that online form with that basic information that I mentioned earlier before you submit your video proposal. And and that, again, is on page 4 of the TLI full proposal invitation document, and that linked text is this Qualtrics form. Videos cannot be longer than 1 hour. Reviewers will be instructed to stop watching at the 1 hour mark. So if you've got significant content after the 1 hour mark, the reviewers will not see it. But I would say for last year, our longest video was about 38 minutes. So certainly 1 year doesn't indicate how all future years will go, but applicants who submitted video proposals last year didn't have any problem adhering to being well under that 1 hour time limit. Like Skype proposals, don't read your responses verbatim off a piece of paper onto the video. If you're that prepared, just submit online. And like I mentioned, it takes reviewers a lot of time to take notes on applications. So if you've already written everything up, go ahead and submit online so the reviewers have the advantage of reading your words directly. For submission, do not submit your videos via email. Videos can be super large, and very few videos actually will go through, very few videos that are over a few minutes will be successful with email attachments. So please submit via Dropbox or similar method. Dropbox is a free online tool that allows you to transfer large files between users. You can you can create an account on Dropbox for free. It's pretty easy to use. But if you have a similar method, you're welcome to use that as well. You can submit your attachments that are required either via email, or you can use Dropbox or whatever other method you use to submit your video and submit them all at one time. Either way is totally fine with me as long as you get your attachments to me. Toward the end, make sure you allow enough time for your video to upload before the deadline. Depending on the file size and your internet speed, some videos can take a long time to upload. If it's 4:53 on the day of the deadline and your internet service provider decides to conk out, then you can have an issue. So please don't wait to the last minute. And I can say that quite strongly about all methods of submission. Please don't wait to the last minute. Although I know that happens, but if you at all can, please plan in advance. And like other proposals, video applicants must submit the required materials, including the attachments, by July 6th at 5 p.m. Eastern Time. And we're getting to the end here. So you've made it this far. Congratulations. So applications, as I mentioned, because there's nothing like repetition for learning. Applications are due July 6th at 5 p.m. Eastern Time, emphasis on Eastern Time. We recommend submitting early to avoid this, addressing any issues with technology, not to mention the stress of, doing something at the last minute, although some people, I think, use that as their cardiovascular exercise. So if that's your jam, go with it. But if you can submit in advance, please do. Applicants will be notified of funding decisions by August 20th, and final targets and execution of grant agreements will be done by August 31st. So please make sure that the email address on the application you submit is accurate, because that is the email address we will send notification to. So please double check that before you submit either your FoundationConnect proposal or before you submit that Qualtrics form to us. If you submit and think you've made a mistake, let me know and I can make a change on the back end to your email address. Some of the other important dates for grantees are listed on the slide on your screen. There is a more complete list in that full proposal invitation document that I sent to you all. And we do ask that you don't call or email about the status of your application during the review process. We'll be really, really, really busy with application stuff as well as other things that we also have going on, because TLI is not the only program that I manage at AIDS United, although it's my favorite. Don't tell my other program. But we will be really busy, and it just will delay us working through our long to-do list. So please humor us and don't contact us during the grant review period. So we now have time for questions, and I see there's 2 questions up here. So let me look. Someone asks, what about support groups that are trans-led for trans people? So this is, I think, probably in relation to direct service versus leadership. So if you want to have a support group that is, trans-led for trans people, if you want to include that as a part of your proposal, you'll need to explain how that support group increases the leadership ability of transgender people. Support groups are great and really important and really can help trans folks deal with many of the issues that they face and many of the marginalizations and oppressions and daily indignities that they face. But for this initiative, it must be focused on leadership. So if you want to include a support group, make sure to talk about how the support group leaders will gain leadership abilities through the running of the support group. And let's see, someone asked, did you say it does not count you typing in a text box as activity? Yes. Sadly, that is true. FoundationConnect, when it's looking at what it considers activity and inactivity, it does not consider you typing to be an activity. An activity in FoundationConnect is something like hitting save or going to another tab in the application. And I know that's really annoying, but that's just the way that it is. And someone asked to put up the timeline again. So there is the grant timeline again. Someone asked, how come we can't see the other questions? That's a good question. This is the way the system is set up. It is set up to send responses to the chair of the webinar and not to everyone. So that I can look at potentially changing that in the future. But that is the default of the way things are set up. And we have a question: is the funding a one-time grant? Yes, it is. This is a one-time grant. And then the follow-up is, if yes, do we address how we'll sustain the leadership development program? That will be great if you can address how you'll sustain the leadership development program in your proposal. We actually took out the question about sustainability because it's such a challenging thing. These grants are very small, although I guess whether a $20,000 grant is very small depends upon the size of your organization and the size of your budget. But in the grand scheme of things, a $20,000 grant over an 8-month period is generally a very small grant. So we don't require organizations to address sustainability anymore. But if you have something you want to say about how you will sustain it after the grant period's over, please do, and that especially will be helpful if you're talking about hiring someone. Whether, if it's an intern or a fellow, that's one thing, because those are sort of time-limited positions. But if you're hiring, a part-time staff member or you're increasing a staff member's time, then that will be helpful for the review committee to know, because we don't really want people to lose their jobs after 8 months, although we also acknowledge that happens. And if you're getting a funding that's just for 8 months, then that is a potential thing that's going to happen. And until we receive more funding, more money for TLI and have more funding for it in the future, we are limited to these very short grant periods. Let's see. We have a couple of questions. I'm so impressed. The first webinar I did, no one had any questions. Let's see. And I want to make sure we're good on time. We're fine on time. Oh, we have a few questions. This is very exciting. Thanks, everyone. How often are progress reports required? So very good question. There are 2 progress reports for this initiative. One will be given informally as an informal presentation at the convening in January. And what will happen is you would give a presentation to the group about your project and where you're at and what you're doing, and I would take notes on that. And then similar to the way the recorded Skype calls go, I will send you what I've typed up and email that to you so you can verify it, and then that becomes your interim report. And then a final report will be due within 30 days of the end of your grant period. Let's see, someone asked, can we get another email with the RFP? I think it may have been to the wrong person. Yes, so the person who asked that question, just send me an email at swees@aidsunited.org. And again, that'll be displayed on the last slide in a minute or two, and I can definitely send you another version of the RFP. And there's another question for the November public policy meeting. Will that need to be a trans community member? I think we can identify someone for January, but not sure if we can by November. Would we need to be able to select a transgender community member from our advisory board for the November meeting? So the way the Public Policy Council nomination will happen is it actually will be a pretty fast process. And we will want someone to be available to attend the November meeting. And AIDS United will cover the travel costs for the in-person Public Policy Committee meetings. There are some calls that won't require any expenditures. But we will start the grant period, starts September 1st, and our goal will be to have someone nominated by the end of September. Because that nomination needs to go before the Public Policy Council to make sure that it is approved by the Public Policy Council before that person becomes active on the Public Policy Council. So it's actually a fast timeline for the Public Policy Council. The person does not have to be transgender who is on the Public Policy Council. It is a requirement that the organization be a grantee, And because the organization is a grantee, that organization will be serving transgender communities. We would love for the representative to be a transgender person, but that is not a requirement of being nominated. And that being said, I also should point out that the way the nominations will happen is that grantees will nominate themselves, or they will nominate another grantee to be on the Public Policy Council. There's a relatively brief application that's filled out, and then we will send those applications out to the grantees, and the grantees will vote on who the representative is going to be. So that's something to keep in mind as well, that AIDS United does not select the representative. The grantee cohort selects the representative for the Public Policy Council. Let's see, another question. If you are reconstructing your board of directors, and one of the reasons for applying is identifying a trans individual to serve, will that be a penalty in the reviewer's eyes? No, definitely not. I would say if you have any board members, list them. If it's clear that your board is pretty thin right now because of your restructuring of your board, talk about that on your board list. I think that's great. Be honest about that. Be upfront about that. If you have no board members right now because of that same restructuring, go ahead and submit a document for your board of directors list and talk about that and what's going on and what your approach is, what your challenges have been, how you're approaching it, and then how that's relevant to your TLI application. Let's see, another question. Are there participants in the leadership development program are the participants in the leadership development make a commitment to their involvement? I think that's a question about if people who are involved in the leadership cohort have to make a commitment. So the grantees have to make a commitment. But as far as participants in your local program, we would love them all to make a commitment to stay through your leadership proposal, through your leadership project to the end. But the reality is that life happens and people drop out of the leadership project that you have going on. That happens all the time, and especially in particularly in marginalized communities. Other priorities come up. If it's going to your leadership project versus getting food to eat, then getting food to eat is going to win every time, and as it should. And so we would love your participants to stick it out to the whole thing, but we expect that folks will drop out of your leadership project as it's going on. And if I didn't understand that question, please go ahead and resubmit that, and I will try to answer the actual question you asked as opposed to the one that I think you asked. Another question. Are we permitted to use funds to offer stipends to our trans leaders for their work? Absolutely. Yes, we love the concept of you paying your leaders for their work. That's really important to be able to support folks. So you definitely can use part of your $20,000 request to give stipends to your transgender leaders. Where are the November and January meetings taking place? So the public policy meetings are generally in Washington, D.C. in a hotel. The public policy council meetings are generally 2 days of meetings, and then there is an optional lobby day that is generally on the third day where you go to the Hill and you advocate with folks on the Hill for HIV-related policy priorities. The lobby day is not optional, but it's right after the meeting. It's a really important, great thing to do if you can. And then as far as the January convening, it might be in Washington, D.C. It might be in another city. That's going to depend upon our budget, which we are still working on figuring out. So TBD on that, but we will be paying for wherever it is. We'll be paying for wherever it is. We just don't know what that's going to be yet. So we're figuring that out internally right now. So the mentors need to be transgender. So within a leadership program, if you have people mentoring other folks in your local community, it's probably helpful if they're transgender and have a similar identity to the leaders you're training in your community. That's not required, but I would say if you're going to have mentors who are not transgender, then I would say definitely explain in your proposal your reasoning behind that, and maybe they have particular professional skills or they have particular public policy skills that you want to instill in your leaders that you're training, in which case that's perfectly understandable and justifiable. Just make sure you explain that to within your proposal. Another question. This is the last one that's been submitted for right now, so if anyone's got any other questions, go ahead and toss them up here. And we still have time, so feel free. We currently meet MIPA standards for trans folks, but need to increase the input of HIV-affected trans folks in our program. Is how we will increase engagement with HIV-affected folks something we can and should discuss in our application. If it's relevant to your proposed project, it depends on how narrowly focused your project is. If your project is, I guess it was an overall yes, but it depends on your the level of involvement you have right now from trans folks in your local community versus where you want it to be, and how much that difference might impact your direct your project that you're proposing. If it's relevant, yes, definitely go ahead and address it. If it's not relevant, you sort of can choose to address it or not, but the committee does love to see organizations striving to increase and to do better in their meaningful involvement of folks of trans experience. So I would say err on the side of addressing it, but that sort of depends on your particular project. Another question, would stipends for participation be an allowable cost for this proposal? Absolutely. If you have leaders you're training, you definitely can pay them a stipend for their time, and that's a really, again, a great way of showing respect for your leaders whom you're training in your community. If they're showing up, they're giving you their expertise, and or you're giving them leadership skills, they're giving their time. So if you can work it into your budget, it's a great thing to do to be able to give them a stipend. And I also should say, now that I mentioned the word budget, as you might have seen this, or you might have noticed by its absence, we do not require a budget form for this initiative for folks who are applying, because we're trying to be as relatively low barrier as possible. I know we still have ways to go on that, but one of the ways we're trying to be relatively accessible is by not requiring a budget form of applicants. So you can reviewers, it makes it easier for reviewers to have an idea of the way you're going to spend your money, but that is not required. We require budget forms from organizations to whom we give a grant. So if we give you a grant, the first thing we'll send you, one of the first things we'll send you will be an Excel budget workbook that you'll need to fill out that will tell us where you're going to be spending your money and what categories, on what people, and will get us all of the great and glorious details then. But we do not require that as part of the application process. And as we're wrapping up here, I want to go to the last slide. Again, please, any other questions or concerns as you work through your application, I'm here to assist you. I love helping people out. Please contact me at any time. There's my email address, sweese@aidsunited.org. My direct phone number is 202-876-2851. So please feel free to reach out to me. Are there any other questions that anyone wants to throw up before we disconnect for the evening? Yes, and someone asked if the slides will be sent out or posted. So I'm recording this call, as you might have heard earlier, and the video will be downloaded probably by me tonight, and then our communications person will post it to YouTube likely tomorrow, and then I will send a link out to the video either tomorrow or over the weekend or very early next week. So you can refer back to it if you need to. And someone asked about my pronouns. Yes, my pronouns are they, them, and theirs. Thank you for asking. I appreciate that. Again, thank you all so much for being here. Thank you to those of you who are not on the West Coast for being here relatively late at night. Really appreciate your attention, really appreciate your questions, especially appreciate your interest in this initiative, and most importantly, thank you for your work with trans communities. We look really forward to receiving your application and hope you all have a great night. Bye.